A global developmental delay is a catch-all diagnosis when delays happen in several developmental areas. Getting on a wait list to have a child evaluated for autism may be important. When parents start to see that their child isn't meeting milestones, they usually think that it's just a delay and eventually they'll catch up on their own. But this is not always the case, and especially if you are delayed in several areas, it's really best to figure it out what the delays are in and to start treating them. So today I'm going to talk all about global developmental delays. Hi, I'm Dr. Mary Barbera, autism mom, board certified behavior analyst, and best-selling author. Each week I provide you some of my ideas about turning autism or signs of autism around. So if you haven't subscribed to my YouTube channel, you can do that now. When my husband first mentioned the possibility that Lucas might have autism, I went into denial and didn't even want to hear the word autism. I didn't see any signs that he was delayed, but wanted to prove it to my husband and myself. I called up the pediatrician and asked him how many words should Lucas have at that point, and he was just 21 months of age. The pediatrician replied that at a 21-month-old level, that the child should have 25 or around 25 words. So I started counting, but I was counting any sound or word approximation that Lucas had that maybe I hadn't even heard for a month or two. But I was counting words like E-I-E-I-O as 5 words. And I was also counting little phrases that Lucas might say over and over again. We used to take him to the museum and there was a sign there, please do not feed the ducks. And my husband would read it to him and then say, please do not feed the ducks, quack, quack. And Lucas would run to the next sign. And my husband again would read, please do not feed the ducks, quack, quack. So in the middle of the night, when Lucas said, please do not feed the ducks, quack, quack, I actually counted that as 7 words. I counted the words. They added up to 25 words, but they weren't really words. And I didn't know how to get Lucas to talk more, to get those words out of him. Now, 2 decades or more later, I definitely know how to get words happening with kids and to get kids talking or talking more. But I was in a deep state of denial, which really hurt Lucas for over 15 months. And that was a problem. So I did write a video blog on denial, and you're going to want to check that out. Signs of developmental delays bring parents into autism denial. Even if it's just a delay, my child-friendly techniques can still be used to help your child. Kids with delays and autism can get a lot better, and in some cases they can even get all better and become indistinguishable from their peers if you treat it early and pretty intensively. I did do a video blog called Is Recovery from Autism Possible, where we talk about the rates of recovery. They're not as high as the initial studies in 1987. But I do believe that there are a lot of kids with high functioning autism and language delays that would meet the criteria that are actually getting better with intervention. So I don't know that we have great data on recovery, but we don't have a crystal ball. We don't know how your child is going to do in the end. But all I do know is that we really need to work hard to teach our children as quickly as possible at the first signs. You can learn my step-by-step ABA child-friendly approach by first starting out with my autism quiz at marybarbera.com/quiz. It'll only take you 2 minutes. It's for both parents and professionals, and it'll get you on the right path to learning more about my approach and how you can help your child. If you're seeing any delays in your child, don't hesitate to get started helping your child today. Remember, go to marybarbera.com/quiz, and I'll see you on the other side. If you like this video blog, I would love it if you would give me a thumbs up, leave a comment, or share it with others who might benefit. And for more information, I will see you right here next week.